So before we get started, like always, I like to start with a few breaths together. So if we place one hand on our heart, one hand on our belly, and close your eyes, we're going to start by a slow inhale through the nose and a long exhale, just to quiet the mind. Take another inhale and a long exhale. Now we're going to take two. We're going to solely breathe in through the nose and out through the nose. Inhale and a long exhale through the nose. Thank you. I always like to start this way with guests just because I feel it really brings us in heart coherence and just it's going to be just a real conversation. Like we're together on the couch and I want people to feel that. I want them to know that each guest were handpicked for me. And I truly do, especially with you.
Yes.
We have to share. I mean, how even
Yes.
you came to me. I met you, so Dr. Daisy Clark, which is such an honor to have you here.
Thank you.
And I talk about how you found me to everybody now.
Yes.
Because it redefined my knowing, how I lead my life, where I'm guided. And I was guided to go to cons, to the Shield documentary. I felt it. When Anthony and Teresa invited me 3 weeks prior, I just knew in my gut. And everybody's like, oh my gosh, the timing is wrong. Everything's so fast. But I just knew I had to be there. And meeting you there confirmed that 100% for me. I mean, so many other things, but you alone. And I want you to share. When you saw me, I want you to understand how you first got to know me and then when you saw me in cons. I just love this story.
Yeah, so I was in a period through dental school where I had a really low season. There's very demanding work. I had to do clinics, I had to do study, and physically I was just depleted. So I had maybe a few months where I just felt like I wasn't getting enough, like I wasn't given enough. And I was in a very low point through dental school. I started doing, like, I'm a doer, I do stuff. So I started watching videos, trying to do as much as I could to get better. And throughout one of those days, I just had a really, really low day at school and with the clinic and stuff. And I was browsing at night, just watching YouTube videos, trying to like comfort myself and feel a little bit better. And I ran into a little short of you in a podcast, and you were talking about how you overcome your situation with your husband and what you were doing. So I just decided to watch the full episode, and I did, and I thought it was a really good story. I felt like, really good about keep trying and keep doing. So that probably was in my last year of dental school, and I forgot about it. Cans came around, and I was not sure I was going to go. So they also invited me maybe 2 months prior. And I was not sure. We had a lot of stuff going on at the moment.
Yeah, because it's a big deal to fly all the way to cons for a film
and
premiere.
Then it was a short notice. We were not prepared. And we had a lot of stuff going on. Other events, other meetings, I work at a university, so I was working and I had a lot of stuff to do. And I was like, no, it looks really good and pretty cool, but I'm not gonna do it. So maybe a few days before it happened, I looked at the Shield invitation and I see all the documentary stuff. And I have always been an advocate for women's health. And I was like, this is a great opportunity for me just to go and learn about women's health and to get to know other people, the biohackers, And I was like, I have to do it. And it was probably 3 days before I had to go. So I had to call my girls and be like, hey, I got invited to this. It's very short notice, but I feel like I have to go. And are you in? And my team was like, yes, let's go. Let's do it. Let's find flights. We find the flights, accommodations, and then we're in France. And we get there. We have the networking event, which was the first day. We get there. I'm talking to people. I have Adri. She was like telling me, this person does this and all that. And I was just walking and I saw you. I saw you there and I was like, I have to go say hi to Melissa because I remember that time where I had that very low point in my life and I watched your podcast. So I just went to you and I say, hey, I just want to let you know that I watched your video in the darkest season of my dental school journey and you helped me a lot. Just by hearing how you were able to push forward, I felt like it was a sign that I needed to keep going. And maybe I didn't think about it after that a lot, but it was like a little of hope that I can keep doing this.
Wow. And that for me, I just felt it. And when you came to me, the rawness of the shock that I was there and for me to see that I had that impact, because sometimes I don't know who I'm going to reach. I really don't. And this is proof that I'm not doing this for all the film being in front of the camera. It's like, no, I can reach so many that are in the lows and lows, maybe in the middle of the night, and they are strolling, and it could be anywhere in the world. And hopefully my video will be that beacon of light that keep trying, that it's
Yes.
going to be okay. And you're going to be aligned with the resources, and you joining this movement with Biohack Yourself Media
Yes.
and what they're doing. This is a huge resource to help women, to help others in the lows as to the tools. The
Yes.
tools and that hope and that light. And so I was so moved by that, because sometimes I don't, I'm like, oh, that video, I forgot about that video or that podcast. And that it still reaches people. And it's doing exactly what I prayed for, is
Yes.
providing that light and that beacon. And especially, I love that you mentioned, dental school being so heavy and so hard. And I don't
Yes.
think a lot of dental students understand that when they even apply, and the toll that it will have on their bodies, on their mind, and how that profession continues to be that
Yes.
constant pressure, that constant where you have to be perfect and it's never enough and you've got to do more. And it's also in your mind, in your thoughts, start spiraling. I'm not doing this well. I'm not as good as maybe this, whatever was going on in your mind there in dental school. And I'd love for you to maybe share, like, what kind of thoughts were you spiraling into? This is too hard, or I don't know if I can do this, or was it you can never, it seems to me it's such a perfectionism type of profession that you can never achieve that in your mind, right? You create these thought patterns.
It has a high standard. So, first of all, to get in, you have to work really hard. And I think you work really hard, you get accepted into dental school, and you feel like I can do everything. And then it's a high paced environment, you're learning a lot, you have very little time. So you leave aside your needs to like resting, maybe mental health. And it has a lot of expectations. So once you enter dental school, you have expectations of what to do. And I think I told you this when I met you. We have to perform at a high level during dental school. You have to have good grades, you have to see your patients, you have your clinics, and you have the expectation of I have to graduate, I have to do my specialty, I have to open my own practice, I have to make a lot of money. And you don't really stop. So you enter, study, 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 then you go specialty, and there's always a lot more because it has a high level of like expectations. You are expected to succeed, you're expected to make a lot of money, you're expected to just be wonderful at what you do. And I think we don't stop to look at ourselves. Like I went studying and doing my clinical work, and it didn't matter if I was tired or if I was sleepy, I had to do it. So I had to find ways to keep going. Maybe drink more coffee, maybe stay more hours, maybe study at the library so I don't get sleepy. But I had
So
that.
you override
Yes,
ride your system
yes,
constantly.
constantly. And
Yes.
you're not listening to your body because you have to get it done. And I think that's something that I have experienced not only with myself, but with my peers that were in the same situation, that we have to keep going. There is no option.
Yeah. Did you see a lot of did other peers talk about their mental health as well? Did you see the decline in so
I
many?
think there
I think a
is.
lot of us do a really good job hiding it, but I'm just curious now if you look back, were there others?
I think there is a lot of lack of communication and awareness with mental health. There is not a lot of people that is talking about it. You don't hear your professor tell you that you need to take care of your body or your mind. You're expected to do what you need to do, but there is not a lot of talk about mental health. And I did experience it with my closest friends through dental school. Like they were also going through depression, some of them have anxiety, and they kept going.
Yeah, because you've invested now, which now is almost like $500,000. When you're done with dental school, so that constant pressure of you just got to grind through the 4, 5 years, but what it does to your body, that toll over time. And then you jump into, like you said, private practice or owning and the pressure of paying that back. So you'd really never stop. So think
Yes.
of a decade of that and what it's doing for dentists. And that's why I'm so glad you're talking about that, because I do feel this conversation needs to happen in dental school even before you're
Yes.
applying. And it should be part of the program because there's so many of them struggling, and we're not. We need dentists. I feel it's the first front line of defense for so many diseases. I think the mouth should be the first place that we look at, but we're not helping the providers, from day one. And it needs to start in school and advocating for taking care of themselves first, noticing what's affecting their nervous system, the slowing down, normalizing that, and showing them that they need to take care of their body first before they're going to heal, thousands of patients
Yes.
and go out there. They need to start with them first. And I think you having a voice is sharing the struggles of dental school and where they're not addressing the constant pressures. And I know it's not the only school program. There's other hard medical, but there's a difference with dentistry. You're working in millimeters, and there is a pressure of perfectionism, and it's never enough. And there is a heaviness of the financial pressures that we're not talking about. And there is a closeness, the patient that you're working with a constant basis, and that they're not talking about, that's affecting your nervous system, which in fact will affect your gut issues, your hormones, your
Yes.
anxiety, and maybe not sleeping. And
Yes.
so for you, do you remember when you started having those body whispers starting school? Like, did it start in your gut? Did you have gut issues, sleep issues? Where do you find that you had your first little signs, little whispers?
I actually have an interesting story
Okay.
because in my first year, I got diagnosed with ADHD.
Okay.
So I was having trouble concentrating, doing my schoolwork, and it put a name of what I was like struggling with, but it didn't give me a solution. So I just kept going. And I remember you study, and then sooner or later you're having a harder time getting up in the morning, and then you're missing your meals, and then now you miss the gym. And it goes by layers, it accumulates as you go. So it wasn't on a day that I woke up and I was like, I feel different. It was more of I'm struggling a little bit more to get up in the morning. or I am more tired. And now I'm picking maybe sleep instead of studying. And everything just goes from there, because the minute you're not sleeping and you're not eating, your hormones. I remember through my last year, I had a lot of inflammation because my cortisol levels were so high.
Yes.
So I didn't think of my body in a way that I needed to fuel it and support it throughout school. I was just performing, and I wasn't supplying my body with the energy that it needed or the rest that it needed. So in my last year, I remember I was so inflamed that when I graduated, within 2 months, my face looked different.
Oh.
And I never thought about it, but I had to see myself out of dental school to actually know that something was wrong with my body.
Wow. I'm so glad you're mentioning inflammation, because yes, the body in that sympathetic, the fight and flight causes inflammation, which is the root cause of any disease, any cellular change, mutation, more inflammation in the body. And that is the first sign that you'll see. And it causes more pain. Probably, did you have more like aches and pain? Did you notice
I
that?
did.
Yeah.
Mostly, I feel like I was getting tired, like not getting enough rest, and I was not performing like I wanted to do.
And so
But
your cells were
since,
kind of depleted, like
yes.
oxygen to the cells,
Hmm.
and not
And
getting the
so,
repair.
since I am a doer, I was doing more stuff. I thought I have to eat maybe cleaner, I have to work out more, I need more motivational videos, but I never stopped to say my body needs this rest, or my mind needs to have a couple of days where I'm just not doing anything.
Anything. So now, if you can create a shift for dental school, what do you think? Do you think it's like a course, a mindfulness course, or a way where they can be given the tools to take care of themselves throughout dental school? Do you think that be a solution?
I think it goes beyond that. I feel like you need more awareness of the connection between your physical body, your emotions, your brain. So from before you start dental school, you can take care of your body, your mind, your emotions, because in dental school there is no time to implement a nutrition plan or a new gym workout. You have very tight schedule. So you have to get up, go to your class, and you go to the clinic, then you come back, you have to eat dinner, and you have to study. And the next day you have to do the same. But if you come into dental school and you know already your body and you have a routine, then it will be a lot easier to prepare, do your meals right, maybe book your studies in certain hours and schedule your sleep. I feel like a class will be helpful, and people talking about it will be helpful, but also having more awareness before going into dental
I
school.
like that. Yeah,
Being
prepping your body
prepared.
beforehand
Yes.
and meant so almost physically prepare your body for what the load will be, the stress load, but also you've already incorporated these tools that you've learned, so now it's going to be much easier to integrate them through the
And
program.
having access to the tools that you need maybe will make everything easier. Sometimes we don't speak about it. We have expectations. We have to finish that with a good grade, because then you have specialties coming and then you have to perform. But if there is a space where you can actually leave this aside and focus on your mental health or your body without being like feeling guilty about not doing it for a couple of days, because that you see a lot, feeling guilty when I'm not studying, or I have to be there, I have to do this. And if you have a space where you can go and relax, and this is the time for myself, I think that could be useful
I
too.
like that. I think that's a huge tool for anyone thinking about applying for dental school and having the preparation. I even talk about that even in my book about preparing if you want to have children, right? To prepare mom and dad, do detox, prepare your bodies because it's epigenetic what you pass down. So you're saying now for school, prepare your body, learn these tools before so you don't feel guilty when you're taking that time, which I think this is a very, very smart solution to a
Yes.
very big program. Because right now, to create a shift in the educational system would take a lot of time, right? You'd
Yes.
have to go through so
You
many
cannot change
so many people.
everything.
It would
Yeah.
be so hard, right? It's kind of like us trying to change the whole entire dental profession right now. Okay, we start by education of the patients,
Yes.
supply and demand, and for dentists that are interested in switching, there's some biological training that you can do, right? Certifications. So now I love this. So are you creating that program?
We are.
You are.
So
Okay. I love
we're
that.
working with a lot of tools. We have a fitness app and we have supplements, clean supplements that help perform better. That's how we ended up with the biohacking people. But I think more than anything, it's bringing awareness to the things that are happening, things that we don't really speak about.
Yes.
Because I felt alone throughout all of dental school. I was trying to do and find solutions, finding videos, but I didn't hear my professors of my classmates
And the peers are
tell me
probably competitive
about.
too, right? A little
It
bit,
is very
right? Very
competitive.
competitive. So
Yes.
nobody wants to say that they're struggling, right?
Yes.
Yeah.
And especially when I got diagnosed with ADHD on my first year, I was really struggling to accept that I needed to change the way I was studying and the way I was doing things. But I felt alone because none of my classmates were saying like we're struggling too, or you don't even think about it. You have to do what you have to do. You go perform and then you go and maybe think about it on your free time. And then the next day you have to come back to that high performance and do what you have to do.
Yeah, so you feel very much alone, which you probably were not alone. And there's probably very much so many that were struggling too, but everyone feels, okay, a little bit that competitive or don't want to be a burden and you have to do it. But, you having a program that preps the dental student but whole body, right? Which is biological dentistry. We
Yes.
don't look at, okay, you going into dental school as just one, we only focus on the mind, but let's focus on, your
The
gut
rest of
health, the
your
rest of your
body.
body, your hormones, your stress levels.
Yes. And one of the things I decided to go into dentistry is because I work as a dental assistant before and we were doing implants. And I saw the difference that it made in a person that had no teeth. And then after getting the implants, how their glow on
Mm.
their skin and their health got a lot better. And that was like one of my first motivators to try to go into dental school. But just like we educate the patients about taking care of their teeth and taking care of their health, controlling their glucose, all these steps, if we start with the students by saying before you go to dental school, it's good if you have a routine, a support system, something that is going to keep your body throughout the hardest times, because it's really hard to study so many hours and skipping lunch. But if you have a routine, I feel like that could smooth out a lot of the complications that we have through.
I think that's a very smart program, and I think it's very needed. And I think so many dental students, and now it's bring this program in an awareness, and that's why we're doing this today, because
Yes.
I know I hear from other dental students, and yeah, it's hard. They're struggling,
Yes.
and so to be able to prep them. And so how can people find you if they wanted to work with you and they say,
Yes.
I will need this, I am applying, or even if they're just in the middle of it too, this would be so
Yes.
beneficial, right?
So we're in the baby steps right now. I have a platform where I share the stories of people in like having mental struggles in either medical school, dental school, and any healthcare profession, because we don't speak enough about it. I have friends who have gone through really hard situations when they were in dental school, and I didn't know. So my first step is bring awareness to these situations. They are happening behind everything we're doing and all the classes and all the clinical stuff. You have people who is going through a lot in their
And maybe
personal
that'd be your
lives.
podcast.
Yes.
You have
So
so many of them. And that
yes.
could be your niche and sharing those stories. So then maybe
Yes.
somebody will find that reel, that
Yes.
podcast.
And so sharing is the first step. We're sharing the stories of the people that is behind healthcare, because sometimes we see my provider and I get angry at you because you're not treating me the right way, or I am not getting any better, but I am not seeing the human that is actually leaving everything to come and take care of myself or come and give me my health back. So we're bringing awareness to mental health. And then we're going to start with taking care of your body and establishing programs that will keep your body going even in these situations like dental and medical
I
school.
love it. I love it. And that's it. It's that one step, right? The one step, you're following that calling. You have your own story. And now you've opened, once you share your story, you've had others be comfortable sharing theirs. And you're right. It's by sharing more about the stories that you have. It might be just having the podcast platform and sharing their stories, or having little reels about them and explain the hard, because you'll know another either medical, dental student will see that
Yes.
and bring that awareness. And then your program will evolve by each client that you'll have and their needs, because everyone will be at a different place, right? And I think incorporating where they learn the tools for nervous system regulation and being okay to because you're so programmed, especially in dental school, that you got to stay so busy, you never slow down. So even incorporating
Yes.
those first 3-4 minutes, during the day,
Yes.
and on what's going to help them incorporate that later on.
Yeah. And I think having systems is something that will keep you performing at that level. So if I start and I already have my nutrition dialed in, if I am aware of the changes that my body will have if I am not eating well, if my hormones are out of whack, I think that will give me like, okay, I need to dial my nutrition right
Yeah,
now.
give them the
I'm missing
signs like the
some.
inflammation.
Yes.
Well, why am I
Yes.
inflammation? Then that can just that awareness when that happens.
Yes.
Okay, where do I need to balance a little bit?
Yes. So
Yeah.
we started with a pure fitness app. We have nutrition included in the app. We have um, tools that can help you cook, that will help you meal prep. We have all these tools in there. We're trying to incorporate also like mental health into the app. We're making like baby steps, like I said, but having a system before you go into dental, medical, nursing school, I think it's going to be better than trying to implement it when you're already burnout, because it's most likely that you're going to get burnout. But if you already have a system in place and you're doing your nutrition, your workouts, and you have a good support system,
Yeah, I
that's
like
going to
that.
change
Yeah, it's
how
like that
you go
healthy
through
container,
dental.
right?
Mm-hmm.
So then you can be prepared for all the challenges that will come around. And nutrition plays a big role. And I know nutrition in dental field, we don't eat very well usually, and we don't eat at all.
You
I know
sometimes
that.
have to skip lunch. You have your
Yes.
patient on the chair, and sometimes you have cookies
Yeah.
in the
Oh yeah,
back
there's
room.
always a back room, always has the
Yes.
treats.
And then you just go from patient to patient, and then
Yeah.
you didn't finish. And now there's a cookie looking at you, and you eat the cookie and you keep going. So
It's so true. It's so true. And I saw it day and day in our office, and nutrition puts on the sideline, and it's so imperative to have that
yes.
sustainability. And I think you truly believe in your program, your passion, and I think this is needed, and whatever I can do to kind of help bring that awareness.
Yes. Thank you.
And because even for me, starting the Calm Chair system was exactly for that, for the provider and for the patient. And I can't help but see it in a nervous system lens, incorporating breath work for the provider. uh, in between patients before they start at the end of their day. This will help their nervous system just
Yes.
slow down and learn and be comfortable in that, and normalizing these tools. And it's almost coming back to simplicity, like you said,
Mm-hmm.
diet, sleep, breath. Those are
Mm-hmm.
simple,
Yes.
but we've moved far, far away from all of those. And that's what we've been programmed to do. And also now we have more environmental factors. So I do believe that for dentists to be aware of their environmental factors on a daily basis, the patients with anxiety, the
Yes.
sonic sounds, the if
Yes.
they're still working. I mean, I don't know now, probably not as much as back then, but they used to work with mercury at school, right?
Yes.
With
Mm-hmm.
amalgam,
The
sorry, that
amalgam.
has mercury in
Yes.
it, and but a lot of them might still be removing them. So, what are the
Yes.
risks there for them as a provider as they're breathing that in?
Yes. And I think also being in close contact with the patient sometimes can affect you
Oh, yes, it's
in
called
a
mirror
way
neurons. That's your nervous system. Yes.
that you want to help more, or maybe you hear the patient's story and you feel like you need to do something. I feel like you're very connected to your patients in that way, because everybody comes with a different story and they want you to hear them and help them with
Yeah,
their
they want you to take
struggles.
you want to take away their pain, right? You want to take that on, but realizing as you keep taking that on from every patient, never release it, it stays in your body. It's called mirror neurons. You're going to mirror their nervous system. So the last actually guest that I had on, Dr. Diane Liu, she works in the nervous system with dental professions. And she was saying that for her, when she goes into the room now, she makes sure that she takes a few breaths, and she had a meditation kind of technique. So then she could be so present and grounded. So when she shows up for the patient, her nervous system is in the parasympathetic. And so the patient can feel that safety, that presence, and maybe schedule a bit longer time to connect with your patient so they can feel safe. And you're not having to feel like you just take on all their pain and their anxieties, because that will impact you over time if you never release those emotions
Yeah,
you pick
and
up.
being at a dental office is really fast paced.
Mhm.
Also, you have one patient, and by the time you finish with this patient, your next patient is already in the chair. So I feel like very little time in between can also affect you how you're.
Yeah, the way they build their schedules. I know my
Yes.
husband had 3 columns plus two to three sometimes hygiene. And I don't know.
Mhm.
I don't know how they can just pivot and time it, and it's very stressful. You're needed
Yes.
everywhere, and you got to keep showing up just as much for each
Yes.
patient. And but again, it's because of the financial pressures, right?
Yes.
Of owning a dental practice and staying afloat. So they feel that they need to have that type of schedule.
And just having that system or the tools, like you said, like breath work, implementing that before going into in the day or maybe on your breaks, and then also implementing it with your team and knowing that they have more resources, that maybe we're behind but it's going to be okay, or let's give this patient a little bit more time. Like having those systems, I think, is what's going to change
Yeah, I
how we
think so.
perform.
I think so. And I think it's going to be that sustainability for the clinician, right? And burnouts, as we know in dentistry, is really high. Pain is really high. As far as I know, so many dentists has had neck fuse, back fuse, and they never feel that they can stop working because they feel stuck. There's the financial there. It provides for their family. So they need help. They need help. And so for you, I don't see anyone working with the students going into dental school. So I think this is needed. This program, uh, yeah, there's. I want to help so much and help students that are thinking about going to dental school. People that are in dental school right now have your type of program and your story. So you don't give up on that
Yes.
project, and you are in the
Yes.
right realm now. With
Mhm.
Anthony and Teresa,
Yes.
they're doing the next documentary, and you have the
Yes.
resource there, and they can try and help you
Yes,
get the word
it
out.
certainly has been a blessing just knowing that there is people out there working and trying to do more than what everybody is doing. Because especially in the medical field and dentistry, there is these recipes of what we have to do. We go to dental school, we learn that we need to have a protocol. Patient gets there, we get the information, we make sure they don't have any complications, and we follow a protocol. But we have these protocols that have been since I don't know when they implemented them, and they haven't changed for so many years. And having just people that is stopping and saying, hey, they might be a different route to this. I think that is a huge blessing, just knowing that there is people advocating for women's health, people advocating for like dentistry now with the new documentary. That's a huge step, just
It
bringing
is
that
huge.
into the new systems. Like we do protocols, but it's not the only protocol.
No, and then
There
people are
is
so resistant to
more.
change, right? But some of us, with our own personal stories, we're like, no, this change needs to happen now, and how can I help? And for me, it's great. I have this platform of having a podcast. I can share a story. Knowledge is power, right? And the more I
Yes.
educate patients, healthcare providers about this, they can start, oh, you plant that seed, noticing, oh, yeah, I'm not sleeping very well. I've got a lot of inflammation.
Yes.
So instead of saying, oh, I have a lot of inflammation, well, I'm just getting older, or I'm really stressed, well, I have young
You
kids
get
at home.
used to
You
it.
get used to it. You
Yes.
normalize
And I,
it.
I think that's something that happened to me. I was used to it. I was used to not feeling well, not having energy, not performing to the same level that I was in the first year. I got so used to it that I didn't even know that I was struggling, that I didn't know that my skin was different, that my body looked different. When I graduated, I think my nervous system kind of said, we're done and we're not going to do anything from here. And I remember going through the first weeks that I was very low in energy. I was struggling to even get up from bed. And I went into a rabbit hole of like finding things to help me get out of bed in the morning. So I started researching, what do I do? Why is this happening? And that's when I came to the vitamin deficiencies and how the cortisol, after you have been stuck in fight or flight, your cortisol levels stay that way. And I didn't know. I was used to it. But after finding all this information, and when I started actually looking into my body, trying to heal my body from the cortisol craziness that I had through dental school, having my body, my nutrition dialed in, maybe clean up my diet a little bit more, exercising, going on walks, that's when I saw the difference.
Mm.
But if you start dental school with this mindset of my body needs certain things and I know my body, the minute that you start to feel different, you already know, or you won't even need to get to that point because you will be giving your body what it needs,
Yeah.
which is the sleep, the nutrition. And I think the support that you need through dental school, more than a class, it will be a system that will be open for you at all times.
Yeah.
Like having this, I'm not sure if it would be like a support group or a line,
Yeah, that'd be a
something
good
that can
idea.
be accessible for you, because we go through the stages at different rates. Maybe I went through it on my last year. I know some of my peers, they were struggling the first year. I know people who dropped out because they cannot do it anymore. But if we had these tools from the beginning, your body will be performing better, your mind will be better, your workload maybe not be easier, but you will be able to perform.
To perform. I love that. And that's almost, you're getting people to listen to their body as they're whispering things. And that's my book, The Gut God Connection, is bringing
Yes.
them back. We've moved so far from not listening to our intuition and those little signs, because oftentimes now I
Yes.
can help. Oh, why did I get sick? Because I know you don't get sick for no reason. So my thought, was I spiraling into something?
Yes.
Because I know thoughts affect the body as well. It's very much emotional. I say
Yes.
suppression is the silent
Yes.
killer, right? And I see that in my own kids still dealing with their traumas in their early lives, and how the mind affects their gut. And then put themselves to being sick. So
Yes.
it's so important to start teaching people back to how to listen and to
Yes.
notice these little whispers so you don't wait. I've had so many guests on that have had
Yes.
cancer and all these things. It's like, and I always ask, okay, what was happening decades prior? And that's it.
Yes.
We're not listening to the early whispers. We're
Yes.
not in it. We're here to say, come back to your body. Listen.
Yes.
Listen to the skin changes.
And stop normalizing, especially in women's health,
Mhm.
because you go to your doctor
Yes.
and you have your labs and your labs are normal.
Yes. Yeah, that's happened to me. Oh yeah, in my mid
and
30s.
you're
Everything's
feeling
normal.
like you cannot do anything
Yeah, I was so
without
depleted.
crashing.
Yes.
So having to break this of, yes, your labs might be normal, but you need to optimize these levels to perform even better. And I liked what they're doing with their documentaries, especially Shield, because it breaks this normal
Yeah, it's not normal.
labs.
I loved how because that's why I brought my kids. I wanted them to see it, to learn so young what's
Yes.
affecting them. And I loved in the first part series where they say your periods, right? Women's
Yes.
periods. Oh, it's normalized. Oh, you might be,
Yes.
so
The
much pain and
pain
all this
and
stuff. That's
everything.
not normal. And I love
Yes.
that they shine that because I don't get any, but at a certain point, it was, maybe too much info, but really all stuff. But it was at the time, my body was speaking the
Yes.
stress, the constant fatigue, the losing the hair. Those were all my body speaking. And I went to a
Yes.
gynecologist. I remember going, oh, okay, this is happening during my period. And it was like, well, you know what was the protocol for me?
Yes.
Take 800 milligrams of ibuprofen. That was the solution. And of course, me being more on the natural side, I was like, no, I'm not going to take
Yes.
800 milligrams of ibuprofen every time I have my period now. And
Yes.
so I kept digging and asking. But unfortunately, every provider that I saw, not one ever asked, how's your stress level?
Yes.
How's what's going on at
In your
home?
personal
life.
And it happens a lot that we, like I told you, in school, you go and you learn how to do a feeling, how to do a surgery. You learn the maybe the medical terms. You learn how to explore the medications and if they're going to have any complications after. You learn everything by a recipe. And it's the same thing with medicine, that we have a prescription for everything.
Yes.
And you go to the doctor and you get your prescription and you're out of there. And I still don't feel well, but you come back and tell your doctor you don't feel well. And what they do is either increase your medication or change it. And I went through that when I was going through depression in dental school. I was doing a lot of work on myself. I was going through therapy. I changed medications 2 or 3 times and I was not getting any better. And I thought something is seriously wrong with me. Why can I get better if I'm doing everything I'm supposed to be doing? But there is a deeper connection of how your body is working. If your body is not working, why your mind will be working at an optimal level. I had to stop everything I was doing and accept that I need to rest. I need to supply my body with the nutrition, the exercise, and I need to slow down and give my body the time that it needs to heal, because doing wasn't taking me anywhere.
But I'm so proud of you though.
Thank
Not
you.
so many people would do that and come to that realization. So I do feel there's a reason why you came to that realization that God has a big purpose for you. And this is going to be huge. And you're going to be saving so many lives. And I'm so honored that I have met you and that we actually
Likewise.
met, because I am so excited that you're creating this and there's a need.
Yes.
So however I can help you. And then we find out that we live locally in Arizona too.
Yeah.
So I'd love to be a part of it however I can and share as this grows for you. And I'm so honored. And how can people find you right now?
So we have a platform online. where we post the stories every week. Every week, I share a story of a student, a nurse, a doctor that I know personally, that have struggled with the same depression, anxiety, maybe feeling like they're not doing enough. So we're sharing the stories, and then you can actually share your story if you feel like you have something to share. You can submit a form, and we'll get in contact and share your story too. And then we have the fitness app where you can do your nutrition, your workouts. There is so many tools in there. Some of the things that I was struggling with was meal prepping. So we incorporate in a way that you can just add your recipe, and then it'll tell you what to do, and then you can cook for the week and you're good to go. So
I
we
like that.
we started incorporating all these little things that make a big difference,
Mhm.
that smooth the process. You don't have 2 hours a day to cook a meal, but you have maybe an hour on the weekend where you can prep ahead. So we are trying to incorporate everything into this system. We call it a system because it's not just one part. It's not just the exercise, not just the nutrition, not just your mental health. I think it's a huge part. Is just like everything is a system.
Yes.
You have to look at all the aspects. And it's something that I missed a lot during my journey. I think I was looking at things separate. I was looking at my mental health with my psychiatrist and taking my medications. But I was not looking at my body. I was not looking at how many months I had been with my cortisol so high that I wouldn't even notice it anymore. So this is why we started like trying to implement little by little. We're working towards making it a bigger, more complete app. But so far we have the workouts, we have the nutrition, we have a lot of tools for learning in there, and we're incorporating more and more every
I love
day.
that. Oh, that's fantastic. Well, thank you so much for sharing today. I know this will reach many, and I cannot wait to share this episode. And
Thank you.
I'm so proud of you, and thank you for the
Thank you.
connection.
Likewise. Likewise. Thank you.